We are currently in Nairobi, Kenya. We are having a hands-on training focusing on ultrasound guided assessment of these hemophilic joints, as well as a new technique called chemical synovectomy. That is a new and innovative kind of treatment modality that can help improve the quality of life in these patients, and that's the reason as to why we are here.
In my view, part of what they're doing here is the training of trainers, okay? With this training situation, they're training medics from 6 countries. These medics will go home, they will practice these interventions and these procedures, practice using the tool, but now they'll also become centers of training for other medics.
So his suprapatellar pole is right here, infrapatellar pole is right here.
We have been doing blind procedures where we approach these knees to do procedures such as arthrostasis or injecting these joints with corticosteroids. We've been going blind techniques, and the disadvantage with these blind procedures, often you may end up injuring some structures such as the neurovascular structures. So with the ultrasound guided, which I've never done before, it gives you that accurate and almost perfect approach to the knee without injury to the neurovascular bundle.
You're thinking the geometry of it, think of it in terms of this. You want something there, there, and there. So boom, boom, boom. Can I have somebody to actually try one of the views now?
Hemophilia is, number one, a global phenomenon. It's not localized. And if you're looking at Africa, one of the problems with hemophilia is that not many of our medics are aware of it. The other thing is, if you look at the African traditional medicine, witch doctors and the like, they can be aware of families who have a history of bleeding, but now they're attributed to curses and supernatural conditions. Whereas if they were aware of what's going on, then they'll be able to tell, oh, this is likely this and needs this sort of intervention.
So nikiwa mtoi, first hatukuwa tunajua kitu ni hemophilia. Tulikuwa ninaumia, ninasuguliwa na maji moto. Mpara ananiambia umetoka kucheza tu ball. Hiyo ni injury kidogo. Nilikuwa na feel vibaya. Ukiona wase wengine wanacheza na huwezi cheza nao.
Okay. Now comes the needles, so I'll give you now the anesthesia in that area. It will sting like a bee sting. All right, it's all right, it's all right, it's all right, it's all right. We're right there.
WFH has provided us with diagnostic tools, with the handheld devices, that's the handheld ultrasound devices that we are going to use to assess these joints, and also they are going to provide the drugs that are going to be used for chemical synovectomy, that is rifampicin.
After nimedungwa hiyo dawa na hiyo factor, nimeona imenisaidia pakubwa. Sikuwa naweza squat, sikuwa naweza kunja mguu, so imenisaidia pakubwa. Nimelala miaka 10 zimepita, sijalala vizuri venye nilala hizi siku 2.
One thing I'm aware of with many hemophilia patients, we are very, would you say, reluctant to start families, because you're thinking, if I've been through this situation and I've suffered all this pain, I do not want to possibly pass this on to the next generation. So you close yourself off from a lot of personal relationships in that aspect, in that sphere. But now with this sort of intervention, this eliminates that sort of concern, because you know that should that still be a case, there's effective medicine available. One of the things I appreciate about the WFH is that they have made it easier to access factor. You might think your donation stops at the patient, but there's a much wider ripple effect. They're the loved ones who are gratified seeing their people able to get a better quality of life. You are having a huge impact, not just on me, not just on the patients in Kenya, but patients across the globe who are unable to access the medications or who would have difficulty. We appreciate you so much.